Johnson & Johnson is planning to ask the FDA for authorization for a booster shot this week. The CDC released a study last month showing the J&J shot is only 71% effective against COVID-19 hospitalizations. A booster would give people who received the one-dose vaccine more protection. Dr. Anthony Fauci appeared on Face the Nation Sunday after the country reported more than 700,000 deaths from the virus. He stressed the importance of getting the country's vaccination rate up to prevent another wave of cases.
We have within our capability, we can make this happen, namely go down to a very, very low level with vaccination and with mitigation. So that's the one thing I want to make sure that our viewers realize, that we've done well in the sense of getting 55% of the population fully vaccinated and 64% with at least one dose. But we've got to keep pushing on the vaccination front.
Dr. Rashmi Jain joins me now. She is a concierge pediatrician and founder of babiesmd.com. Dr. Jain, welcome. So you are in California, where Governor Newsom announced late last week schools will have a COVID-19 vaccination requirement once the vaccine is fully approved for younger children. What difference do you think this mandate will make, and can we expect to see other major school districts follow suit?
Good afternoon. Good to be with you, Tanya. I think this is an awesome statement. So a couple things to remember, and I think we already know this, is that vaccines are mandated for children when they go to school. There's certain vaccines they have to have before they can attend school. So the fact that Governor Newsom is saying that the COVID-19 vaccine will be mandated for children as they go to school is not a surprise. The one thing he did say, and so that helps us know there's still this, is that he is, once the FDA approves these vaccines for those age groups, once we're beyond that emergency use period, that is when they will start mandating that, so the semester following. So for example, if the vaccines get approved by, say, December, the following semester would be January, or if they get approved by March, the following semester would be July. And so there's some time for parents to get these vaccines, but it's no different than other vaccinations. And the reality is this is one disease that's affecting our children and our families now. So unlike other vaccines like, say, MMR or Pentacell, which has protection against 5 different disease processes that we hardly see anymore thanks to vaccination, we're able to make this change now by mandating these vaccines. So it's very exciting.
Yeah, no, you make the very good point that vaccinations have been mandated for entry to school for generations. What has been the response, though, from parents in your practice, and what's been your advice for parents who may be on the fence or worried about getting their kids the COVID vaccine?
That's a wonderful question, Tanya. And, you know, as pediatricians, we field this vaccine question all the time. There's a lot of vaccine fear. There's a lot of vaccine hesitancy. There's information out there. There's misinformation out there. There's opinion out there that poses as information. So there's a lot of things that parents have to weed through, kind of tease through. And I do encourage them to come speak to the medical professional. Speak to your pediatrician. Speak to somebody who kind of has the evidence-based knowledge. Go to valid resources and sites. But my advice always is to look at the bigger picture. You know, what are we doing by vaccinating our children? We are protecting their health. We're protecting the health of their friends. We are allowing them to engage in a society and community where they are safer from disease, from illness, from long-term consequences that we actually, in the case of COVID, don't even know completely yet. There is a lot of hesitancy with vaccine. And when it comes to COVID, I tell parents that the reality is we've been able to test this vaccine on a large number of people really fast. So a lot of parents say, I don't have enough time to see the side effects, or I want to wait till it's been around longer. The reality is, when do you ever have so much funding pushed into vaccine production? When do you ever have so many people who volunteered in the preclinical phases? And now the numbers of people who've gotten these vaccines over the last year is so high that we have a lot of data compared to other vaccines where it sometimes takes a lot longer to get that data. So I think the data is accurate. We've achieved that data effectively in the right manner in a lot faster time frame because we've had such a scary disease like COVID in our community.
And Dr. Jain, switching gears, there are new studies indicating certain strains of COVID, like the Delta and Alpha variants, are perhaps evolving and getting better at traveling through aerosol. What does this mean as we try to get a hold on tamping down the virus? And are vaccines and masks enough protection?
Yeah, so, it's no surprise that viruses mutate, and that's how they become stronger. So this is the good old survival of the fittest, Darwin's theory of evolution. So what's happening with the COVID-19 virus and the Alpha strain, which we knew last year was a lot stronger, and that's the one, the B117 that we talked about quite a few months ago, was able to get farther, move in smaller aerosol droplets, so small as 5 microns, go a little bit longer. We called it the hang time last year when we were first learning about it. And it seems like Delta is doing the same thing. So these studies, the 2 new studies that kind of have been presented to society in the last few weeks, one actually tested hamsters in cages 6 feet apart, 2 meters apart, and they saw that the Alpha strain was able to cross that distance and get to those hamsters a lot better than maybe some of the other original strains. And so it travels in smaller particles. We expect that COVID will transfer itself through droplets. We used to think it was large droplets only, but now we know that those small droplets hang in the air, and we know that masks can actually reduce 50% of that transmission, even cloth masks or surgical masks. So even the non-tight-fitted masks, the simpler masks, are good at preventing 50% of that transmission to people. So masks are important, and vaccines are really the only way we're going to be able to stamp out this disease, hopefully soon, but eventually.
Mm-hmm. Dr. Rashmi Jain, thank you so much for joining us. We appreciate your time.
Always a pleasure. Thank you.